Get any cases whereby parents get the mentally retarded child, saying that maintaining hygiene of the child is very difficult. Like say the child is in the teens, then they come with a request for hair removal. Is this a very dicey situation? We may land up in a medical legal problem over here.
So with the mental retardation, I still have not got any case, but there are a couple of people who are physically challenged, people who can't walk, people who can't move. So for them, going for things like waxing and all is a problem. So then they tend to come in for laser. So I have 2 patients like that. But with mental retardation, I haven't come across any patient till now.
Mental retardation. I am doing 1 patient with mental retardation. In fact, in a very concessional rate because the mother wants to get it done.
Right.
And we have done with the diode laser.
Right.
But only thing is sometimes she is cooperative, sometimes she is not cooperative. But we told the interest. Right. But she is very conscious. She is going for a school. She is a mongoloid child, and a lot of hair growth is there. But we can do if the mother is very conscious, and it seems the daughter also tells that the hair growth she doesn't like.
If the patient cooperates, then one can.
You said you do SHR and the conventional diode in the same session.
Sometimes
on the same spot.
On the same area. First I
Then
do the SHR.
doesn't the chances of burns or all increase?
It doesn't happen. I do the SHR, I give a very high fluence, post which I do the conventional diode laser at as high as 36 joules per shot. Burns don't happen. They
how about post-laser reactions like having erythematous papules and all?
Erythematous papules, sometimes post-laser acne do happen in such cases because you're using a very high fluence, a lot of heat is being used. But then if results are not coming, then people are okay with that because eventually they would settle down.
What we have observed is initially when we give a steroid antibiotic, 2-3 days it settles and then it resurfaces again. And then the papules are really big. So how do you manage that?
With post laser folliculitis or papules, that is a problem, no doubt about that. I do ask them to do a lot of cold compresses initially, immediately after the laser. I ask the patient to keep on doing cold compresses throughout the day practically. So that reduces the chances of erythematous papules being generated there. And like you said, I tend to give them a steroid antibiotic combination for 3 or 4 days. Post which I ask them to use adapalene gel after 3 days. I ask them to use adapalene or benzoyl peroxide every evening for 2 hours or 3 hours. That reduces it, but it doesn't fully eliminate the problem. Typically, it is seen that by the time they come in for their next laser, that is the time when the papules tend to settle down. It does take 4 weeks or so for them to go away.
I think the answer has been conveyed.
Yeah,
we will allow one question.
Yeah, I had an interesting case whereby the patient was not very happy with the hairline generated by the hair transplant surgeon. And he had drawn by pencil and asked how much of hair to be removed. And this was in a patient where the hair transplant was done. So he wanted a restructuring of the hair. So we do get certain such funny requests also.
I do get requests like that, sir, and we do it.
I think some more sessions are there related to hair removal. We can always direct the questions later. It's nice listening to you and also getting so many answers which are practically really matter. And apart from these conventional the indications, hair removal is becoming very important for some of the frustrating dermatological conditions like hidradenitis suppurativa. And it is being shown that it works really well, particularly if you see comedones in addition to hidradenitis suppurativa. That is the condition where hair removal definitely helps in completely abolishing keloidal acne, such things. Next, we have important speaker. I request Dr. Chandrasekhar, the chairperson, to invite and introduce Dr. Narendra Kamath.
Good morning, everybody. Dr. Narendra Kamath is a practicing dermatologist at Bangalore. He is alumni of KMC Bangalore. He was a professor of dermatology in KMC Bangalore till 2 years. Now he is doing his private consultancy. He got the outstanding Young Dermatologist Award in 2006 by IDAL. Dr. Rajendran Gold Medal Variation by IDAL KT Branch 2003. President-elect IDAL Karnataka 2015. Chairman CMC Dermacon 2015. He is also the author of PG and UG textbooks of dermatology. Now he is going to enlighten us with his experience with Soprano. So I request Dr. Kamath to proceed.
Thank you, Chandrasekhar. Rather interestingly, today is a very important day for me. It's exactly 2 years since this machine landed in my clinic and was installed and started functioning. What a fantastic invitation by Alma people. Thank you. So, rather over here, it's quite well understood that my practice over here on this machine has been just for about 2 years. Before that, I used to share hair removal patients along with Dr. Ganesh Pai on that light shear machine. So let me share my experience regarding this particular machine. I would rather say it's a fabulous machine to use. Which is the button for next change? This one. Okay, fine. All of us will agree that any woman, even with one hair on the face, when she comes to a clinic, she will be quite depressed and quite disturbed. Like over here, you can see on the left-hand side, the woman had lifted just one hair above the left angle of the lip to show to me as to how disturbing it was, and the couple of hairs on the chin. And the demand for hair removal has been on the rise of late. And this is true. If you just observe nowadays, children have been maturing faster. They are physically bigger. I would rather blame the poultry industry as well as the meat industry for all of these particular things. If you see over in any poultry industry for a faster yield, or even in the milk industry, they pump in hormones into the birds as well as animals. And children have been getting lots of indirect hormones along with the visual stimulation from the various media. And that's why you can see children maturing faster, and also at the same time middle-aged coming with lots of probably over hormone exposure and getting more and more of, you can say, polycystic ovaries as well as these hair related problems. Now Dr. Dhawan has reduced the work for me with his detailed lecture. Thank you, Dhawan. Now, even though this is a simple procedure, rather a painless procedure, I would always say have a consent of the patient, and a convinced patient is always the best patient. And if a patient has been coming to you for the first time, they will always ask for your experience as well as various photograph evidence to rather convince themselves that everything is fine with the laser. But if it is a patient referred by another patient, then your job is very easy because they already have one person who has responded well. And always keep your camera ready. Any dermatological or any cosmetic or aesthetic procedure, always have a pre-procedure, intra-procedure and post-procedure photographs. Rather maintain them in a sequential way, maintain separate folders for every patient. And to have a successful laser practice, you need a separate dedicated OT. That's what I would feel. Rather, real estate is quite expensive everywhere, I do agree. If you are working in a hospital setup, there is no problem. I'm fortunate I have a clinic with just about 1,800 square foot of area, whereby I've designed everything. And you need a UPS, uninterrupted power supply with at least about 3 kV backup. That's the recommended. If you have something higher, that's well and good. And if you are a resident of Karnataka with the frequent power cuts, I think your settings will go for a toss, and finally you may overexpose a patient to the laser therapy. A good air conditioning in the OT as well as a dust-free environment is pretty important because you need to maintain the integrity of the machine. A good illumination, if not nothing, have at least a focalized OT lamp or else a LED lamp, because that will tell you clearly certain finer details in the procedure. And I use, though the soprano accord machine has got a chill tip whereby the temperature comes to about say 4 degrees, I use the jelly used by the ultrasonologists, and that is always kept in the fridge.